everyone. Okay, awesome. Hi, everyone. Thank you for coming to our session on the Startup Studio model, capitalizing on Maryland's strengths and resources to build health and medtech companies. We are from the MDC Studio. We are a startup studio in downtown Baltimore dedicated to building health and medtech companies from the early stages, even from a literal napkin sketch. We provide hands-on business engineering and fundraising support in parallel to help researchers, clinicians, and other inventors to transition their ideas from the lab to the marketplace. We were founded in 2016 by 8 clinicians and an engineer from the University of Maryland. And since then, we've created 13 companies with many more in the pipeline. We filed numerous patents and raised around $15 million for our portfolio companies. So the goal of today's session is to illustrate our startup studio model of building medtech startups and taking advantage of the strengths of the medtech ecosystem in Baltimore. We have representatives from 3 portfolio companies today. NeuroSonics Medical, Numico, and Sonosa Medical. So we'll start with some introductions. I can start. My name is Nao Gamo. I am the founder and CEO of NeuroSonics Medical, where we've been developing a novel ultrasound device for minimally invasive neurosurgery. I'm also the Vice President of Business Development at the MDC Studio. So Stephen, would you please tell us who you are, what your role is, and a bit about your company?
Sure. Hi, everyone. My name is Stephen Rustano. I am the kind of a dual role CEO of Sonosa Medical, one of the portfolio companies, as well as MDC. I am kind of leading efforts in terms of developing many of the technologies in the companies. I have a technical background. Got my start as a getting a PhD in engineering from the University of Maryland, and came to join MDC Studio to take some of the skills that I learned in academic development and really focus those on translating technologies, really taking that next step towards something that's commercially viable. And so I kind of took those skills and pushed hard really early on in my time at MDC to learn everything that there is to know about commercializing technologies from the earliest stages, and took one of my first projects and turned that into a company that I'm leading now called Sonosa, and we're developing a wearable ultrasound device for diagnosing and eventually treating obstructive sleep apnea.
Awesome, thank you. Brian?
Hello, my name's Brian Mariscalchi. Hello, my name's Brian Mariscalchi, and by training, I'm an anesthesiologist and pain medicine physician. I created Numico, and currently the founder of Numico, and our kind of company is bringing a portable device that measures ventilation quality, and kind of was integral to work with MDC, and looking forward to kind of telling you guys about that process today. Yeah, very challenging. Got both.
I'll take that.
Yeah, so I can also give a bit of background about how I got involved in MDC. So I was actually purely an academic researcher. I came to Baltimore to do a postdoctoral fellowship in the psychiatry department at Johns Hopkins. About 5 years after that, I decided I didn't want to do that anymore. And so I jumped into the startup world. And so I teamed up with the inventor of the device that we started working on. And at the time, I had zero business background, also zero engineering background, and so I realized I needed help, and MDC really fit exactly what I was looking for in terms of getting both engineering and business support. And then after a while, I started to get involved in a lot of the other companies there, helping them out, and I just got so involved that I became the VP of Business Development there as well. Stephen, so you described a little about how you got involved with MDC. Yeah, and anything else you'd like to add?
Yeah, so I think when I got involved with MDC, one of the reasons that really drove me towards an environment like this was just kind of getting excited about all of the technologies that you can develop going into graduate school, and the stories that every lab tells, every PI, every researcher tells themselves and tells the public in these publications and presentations about the good that these technologies will eventually do. And that was incredibly exciting for me too. And that's why I went to grad school. That's why I was doing that research, and I got a little bit jaded towards the end of my PhD, just really getting frustrated with the longevity of the process in terms of getting that technology out into the market. And it's really kind of always moving on to the next thing. And I really wanted to see some of those technologies actually make a difference. And so I found a place in MDC that would allow us to take some of that early stage research and really start doing that translational work so that it could have an impact in the short term as opposed to just kind of moving on to the next thing. So this has been a really fun experience for me. It's been a really educational experience, just kind of learning everything that there is in terms of a holistic view around developing not just the technology itself, but creating a sustainable business model and a company. And then actually seeing some of these early stage technologies get into a hospital and actually contact a patient has just been really inspiring from from the first day all the way to where I am today. So.
Great. And Brian, can you also tell us about your entrepreneurial journey so far and how you got involved with MDC?
Prior to working with MDC, I had tried to do it on my own. It was just me, and companies don't get started like that. They get started as working with teams. So I was writing grants, and I was doing this very unsuccessfully. I got turned down by so many grants, I almost gave up. The other thing was the lack of mentorship. It's so hard to find people who've done this, and a lot of the people who've done this, like even Hopkins alumni, they just leave. They go and they run their companies, and you never see them again. They're not kind of colleagues that I work with. So when I find myself struggling, I kind of started networking, and my business partner lives next to one of the founders of MDC, and we started talking, and then I made the introduction, and from there I was kind of blown away by kind of a team of mentors, not only people who have done it, but are in the process of doing it or have done it several times and had kind of various levels of, kind of commercialization success, grant success, and business success were able to kind of step me through that. So that was great to just have a mentor and be able to meet like-minded entrepreneurs. The second part with the grants primarily was that you have to have a team. You have to have a believable team who can kind of iterate through each of the problems that you're trying to solve with the grant and have a very kind of not only strong background, but also a successful background in doing it previously. So prior to getting in, zero grant work, got accepted into, actually an award stage. Our first grant at MDC got accepted, and then that pipeline continues. So it was very integral in raising early stage money, and culminated in, currently we have an FDA application out for a medical device. So it's very cool. Overall, kind of beginning to end, came in no mentorship experience with engineering. Though I had grant experience, it was not with a team. And I thought, kind of putting that all together was highly successful in the end, and, very hard to find. Also, the other thing that I would say on the flip side was when I started looking at like what was offered by many other startup studios, it was not any sort of favorable kind of arrangement to the entrepreneur or the company who was coming in. It was like, well, we'd like to have like 80% of your company, and we'll do the rest. This was not anything similar with MDC, which was like a let's do this together. Let me provide you resources. Let's have a reasonable kind of amount of equity that grows over time as we're both successful. In stark contrast, this was almost like gentlemen agreements with the founders. Really stark contrast to what else is out there, and even from what's involved kind of internally at Hopkins.
Yeah, I can also echo with my company what Brian said about the having the team. So when we first joined the MDC Studio as one of the portfolio companies, we were able to get the TEDCO MII, or Maryland Innovation Initiative, Phase 1 award pretty early on. And so actually Stephen was involved in helping set up a very early version of our prototype. But also we did the I-Corp program, the NSF ICOR program, for which you do need a team. So actually, the founder, Dr. Gil, the founder of MDC, Dr. Gil Blankenship, and Stephen, and another teammate and I actually went through the ICOR program together. So I'm very, very grateful that Gil and Stephen actually traveled all over with me to do the customer discovery process. So that was something that was really helpful for my company as well. So Brian, I wanted to ask you, you're, in addition to having your own companies, you're also a physician at Johns Hopkins. How do you balance that? How has that been so far for you?
In the beginning, I tried to do both. I tried to be a full-time physician working 5-6 days a week, and it was not successful. It really wasn't until I went down to like 1 day per week or less that it became successful in the company. But it is a very challenging thing to balance. How do I kind of do that? Mainly through early stage, it was grants. So as the grants came in, that funded my time, and it's highly incentivized in kind of the academic institutions to get grants to buy down your time to do the things that you want to do, and then eventually it kind of made sense to then pivot and do this full time, and maintain a bare minimum clinical to just maintain my medical license.
Awesome, thank you. So Stephen, I'd like to talk a little about what's, the medtech ecosystem in Baltimore. What kind of resources have you been able to use, and what do you feel has really contributed to moving your company forward?
Yeah, I mean, there are quite a few resources I think you can access. I think the challenge with accessing many of these is not just finding them, but actually making good use of them. I mean, there's a lot of information out there, and there are a lot of ways to get to this information. There are a lot of organizations that can help you access it. But I think what we try to do at MDC is really try to translate that information and help you utilize it on kind of a one-on-one basis. But I have found from talking to many of the founders of MDC and other people that have come to us is that you can go to many organizations. They can tell you exactly what you need to do, but actually taking that next step, actually putting an application together for a grant, actually filing a patent, or finding an engineer, or whatever that next step might be, actually taking that step is very challenging to do on your own. And so I think despite all of the resources that we do have here, we have a lot that we can use as that that stepping stone. But actually having somebody hold your hand for that first step is probably the most important thing, and that's what we try to focus on at MDC.
So I definitely benefited from a bit of hand-holding at the beginning, at least, because I had zero background in business and engineering when I first started trying to develop a novel medical device. For me, in terms of what I've been able to take advantage of in the Baltimore ecosystem is, like I mentioned, TEDCO has been a great resource for us. We were the first grant that we got was the TEDCO MII Phase 1 Award. We've continued to use TEDCO resources since then as well. But also, my team has done the local version of ICOR at Hopkins before we were able to move on to the NSF full-length ICOR. I think also I've really benefited from the network in Baltimore. I feel it's, the ecosystem still, the community is still small enough that I think everyone, a lot of people are, it's a small world, a lot of people are connected to each other, and I think people are really willing to help each other. So that's been really, really helpful. I think most of the opportunities that I've been able to get, they're not advertised somewhere. It was a lot, most of them I got through networking. So that's been really helpful for me. Also, I found that there are actually a lot of free resources that you can take advantage of. And so, for example, having mentors, even just temporarily, I've been able to get a lot of help. I was part of a pitch competition called Pitch and Mingle, run by the Maryland Innovation Center. And so through that, I had mentoring for several weeks to really clean up my pitch. So that's been really helpful to me. Brian, how about you? What kind of resources have you used in the Baltimore ecosystem?
I think that for grant work, a lot of these are kind of federal agencies who have helped, which was like the National Institute of Health, National Science Foundation. Here, Baltimore, obviously, was MDC, kind of giving the basis of office space and having a startup and the experience and the mentors and the team to kind of pull off some of these grants. The second thing is with patenting. That was done through the university. So John Hopkins Tech Ventures was kind of integral in getting patents and submitting all of the PTC applications and going through that process, which was phenomenal. Beyond that, I think that some of the other things were kind of outside of Maryland. So like manufacturing was brought to like J-Bill. We used Latham & Watkins for our legal team. A lot of things though came from DC, so it's kind of not so far away. Like Latham & Watkins regulatory division for the FDA is in DC. Similar, don't want to muddy the waters, but there's another startup that I do work with, and we use a regulatory team of Dixon Law Firm there, which was integral for remote patient monitoring. So that was kind of some of the things in the ecosystem, and I don't want to muddy the waters, but the other company is currently in working with TEDCO, which was phenomenal. Manufacturing was with the J-Bill. That was kind of a little bit outside of Hopkins, but those were the main players. My iBank, I think, also is in outside of the Hopkins ecosystem. But putting that all together was what was important for the company, was kind of the financing, the grant, the patents, having a startup studio, and that was the complete picture and bringing the team together.
Wonderful. So Brian, you alluded to the fact that there are various startup studios, accelerators, incubators in the area, all with their own specialties and special flavors. So what would you say are the pros and cons of joining a startup studio?
Yeah, I think that these are multi-year engagements. It's very much like a long-term relationship that you want to make sure it makes sense for kind of multiple reasons. I think that when I check my email every day, there's so many startup studios hitting me up and trying to get me doing virtual startup studios, in-person ones. But when you look into a lot of this, some are just purely space. They just say, hey, you want to rent an office? It's $5,000 a month. And they don't really have too much to offer. Or they just say, hey, maybe we have a lawyer come in for an hour a month and you can talk to them, or kind of minimal kind of help there. I had not really found like a quote unquote full service startup studio until I had joined MDC, and still kind of of the successful ones that I know, they have a formula, which is get you money either through grants or through internal funding mechanisms. Put people on your team to round it out no matter what you need. You don't have a CTO, we're going to give you one. You don't have somebody who can help you with grant writing, we'll give you one. You don't have an engineer, we'll give you one. That is very powerful and exactly kind of what happens. So there's the funding component, there's building out the team, and certainly that's there. And the other thing is the ask. A lot of people are going to ask for rent, they're going to ask for equity, and other various mechanisms on their end. I would say a lot don't make any sense and are very challenging to negotiate, either just from a legal perspective or from a incentives perspective. All things I think have to be put together as a whole to make something successful, and you have to kind of take each part of the company and make sure that you're able to kind of get something for each of the little domains that make a company successful.
Great, thank you. Stephen, how about you? What would you say are the pros and cons of joining a startup studio?
Yeah, I think...
and also, what should people look for?
Yeah, so I think the pros of joining a startup studio, I think we've mentioned a few different things. Basically just helping you materialize an idea and take it as far as you as the inventor really want to take it. And generally, our goal is to form a sustainable startup that you can take forward. And so, if getting something to market is your priority and is something that you want to do long term, then a startup studio can be right for you if you don't really know how to take those first couple steps, and you're not afraid to give up a little bit of equity and a little bit of maybe control over how some of the things are done. You're not giving up control of your company. You're not giving up control over the trajectory. But every inventor, especially those coming from an academic environment are going to need a lot of support around them in order to make these things a reality. And that's what startup studios are really designed to do, is to, like Brian said, really round out your team and provide some of the expertise that you don't have when you're getting started. And it's very difficult to collect those resources and build that sustainable team with just an idea or just a napkin with a drawing. And then, so because you're giving up, some of that equity, right? That is, that's a potential downside for some people who want to maintain 100% of the control and then, distribute it, in small amounts over time as they bring in new money. And so, it might not be right for everybody who is very comfortable starting a company. If you started, a handful in the past, maybe a startup studio isn't right for you. But if this is your first, second, maybe even third idea, and even the general set of things you need to do, but maybe you're in a new space, or maybe you're heading in a slightly different direction, or maybe you just have time dedicated somewhere else, like to a university or to another company, and you need a reliable group of people that can help you translate whatever it is you want to do, then a startup studio is probably right for you.
Yeah, and then I think for me, it's been particularly helpful to have this startup studio that is focused on health and medtech companies, because when you're developing a medical device, that looks very different from developing, like, I don't know, a dating app. When you have a medical device, you're going to have regulatory issues. For my company, every time we build a prototype, it takes around $50,000. So I can't, pivot every week. So there are certain things that are unique to developing a medical device. So for me, it's been really helpful to not just have that expertise, but also see several other companies that are few steps ahead of where I've been, so I can see what's coming and how they deal with it. And it's for me, it's having this team. It's very easy to say, hey, Steven, what was it like? Licensing, negotiating a license with the university, and things like that. So for me, it's just been able to ask quick questions like that, which might take long. It might take longer to find answers if I didn't just have someone to just quickly ask a question. And I think for me, what was really memorable for me, where MDC really came in to really help, was actually earlier this year. We were just finishing up our NSF STTR Phase 1 award. There were a lot of delays, so we had to finish by the end of January. I was very quickly able to pull together a neurosurgeon and a couple of engineers and do a cadaver study with a very tight deadline. And so I'm not sure where else I could have made that happen so quickly. So yeah, I think that's for me. That's what's made it worthwhile to give up some of that equity for me. Okay, so Brian, please tell us, what do you hope to accomplish in the near and long-term future for your company?
Yes, and just kind of wanted to say one thing just on the backbone of that conversation was, I think that this is a highly competitive field, and it's one thing to kind of recognize that in order to be competitive for these grants and for this funding, you have to apply a lot. Like for these grants, we're submitting grants all the time. It's every week, multiple, every RFA, every BAA, every single NIH, NSF, DOD, DARPA grant. We submit anything that we can. We repurpose it. It takes a team. There are so many grant applications, and they're not all successful, and that's totally fine. High rates of failure, but you have to have that support to get it out there. But that's true with funding. That's true with the patent. You have to be aggressive on all of this, and you need that support to be able to do it, because it's highly competitive, to say the least. But then, kind of where we are. For NUMICO, at the moment, we're kind of in early stage transition to manufacturing, working with J-Bill and our legal teams to submit an FDA application to start, commercialization, and where we see this, the vision, the kind of mission, vision, purpose of the company is to have a device wherever ventilation and assisted ventilation is being performed, and to reduce the harms and the economic burden and impact thereof. And that was kind of, the beginning stages, because I don't think that many people until COVID hit, may have realized that ventilators and assisted ventilation can be dangerous if done improperly, and also the volume of which we give assisted ventilation to people and the very poor prognosis, such as during CPR. Did you know there's a 10% survival? Like, would you tolerate that? Should we maybe fix it? Could we do it better? And those are the visions of, yes, for ventilation, we can do better, because there's no quantification of it. And both of the companies that I work with deeply have kind of one mission, vision, purpose. It's to quantify what is not quantifiable at the moment, and to provide assistance when we need it the most in the medical field, when we just don't have a measure and we're guessing. It's taking the guesswork out of medicine to improve the lives of others. And I want to see that mission out, and that's kind of what drives me every day, and I've been doing this for at least 5-6 years, so that's what motivates me to continue and see that vision out.
Wonderful. Stephen, how about you? What are your short and long-term goals? Actually, for both your company and MDC.
Yeah, so I'll start with my portfolio company, Synosa. So we are at a similar place as Numico. We're at our early stage transition point where we're taking a lot of the research that we've done with early stage grant funding from DARPA and translating that into our first product. So we're doing early stage human trials with our device, which is a wearable ultrasound diagnostic for obstructive sleep apnea. We're in large animal trials for a therapeutic technology. So we're taking this research that we've done over the last couple of years, and we're translating that into an actual product. We're building up the company. We've hired a number of people over the last couple of months in a number of different specialties, really focusing on product development at this point, trying to get our product through the FDA in a couple of years. And so we've got a lot to do in that time, but I'm really excited about it. It's going to be a fun transition. And for MDC, what we're trying to do is really just kind of continue what we've been doing. We've had a lot of success in terms of getting these companies started and successfully getting them funded. And so, we're looking to find new ideas, new inventors, and try to have as large of an impact as possible, both within Baltimore and in some of the other local areas that need this support. We've just been contacted constantly by hospitals and universities throughout the region because this is such an important need. All of the programs that have some sort of a tech transfer process need a way to get these ideas out of their facilities and into some sort of a company so that they can make the impact that they've set out to have, and they just don't have that pathway to do it. And that's what MDC is really trying to present for as many places as possible. And we're still really focused on the Baltimore area. All of our founders come from the University of Maryland and from Hopkins, and so that is truly our focus. But like I said, this is such a huge problem all over the region that we really want to help as many places as we can.
Awesome, thank you. Brian?
Yeah, and just adding to that, I think that this process of developing companies is getting more and more challenging. The asks are getting larger and larger, not only because the easy problems are being solved, but they're already, got people in this, place doing so. So I think that when we meet, new founders and people with ideas, it is kind of a challenge to recognize that this is not passive. It's not just, I'm going to get a patent and license it. That is not often how it often happens. It can happen that way. But, some of these asks are like, when we, kind of work in the, for fundraising, people are wanting $1 million ARRs, et cetera, till they'll even talk to you. And MDC is here to bridge you to that gap so that you can, actually show up, slap something down on the table. That's a physical device that the engineers made that was funded by the grants or either the fundraising that you did. And then beyond that, be able to show that you are post-revenue and are generating and on the upswing and you have growth. Those are the asks, and you have to skip steps and you kind of have to get there creatively. I think it's much more challenging, and every time I go along, I find that it is very interesting how competitive and how much it changes year to year for the ask, but also, certainly in a recession currently, so it doesn't get much more challenging than finding money. Grants probably a little bit easier, but neither here nor there.
Yes, and then I can talk a bit about my company as well. So we're actually, so we spent a few years focusing on one technology. We actually pivoted quite a bit. It was initially, we're developing a therapeutic ultrasound device to make brain surgery a lot less invasive. And we were initially envisioning that device would be used for brain tumor surgery, but we did a lot of. But as a result of us doing iCore, we didn't sense a lot of enthusiasm for that particular application. So we actually spent several years pivoting. We're actually in the midst of another pivot again. But yeah, it's been really important to me to have that support, like both Stephen and Brian mentioned, because it's unpredictable. It's occasionally it swings between fun and frightening at times. But yeah, it's a slow process trying to get a medical device off the ground. So yeah, that's been my experience.
Yeah, and adding to that, these problems that I think everyone here today is solving are very complex, and it's also hard to translate that into languages and kind of simple, plain, clear English that others understand. Having a team of entrepreneurs and mentors, and being able to even use TEDCO to bounce ideas off of and show pitch decks and get feedback, and using their marketing, advertising, et cetera, all of that refines pitches and makes us successful when we try to explain this to others, not only for grants, but also for kind of financing and fundraising. And it's just so important. You kind of mentioned pivoting, but also it's not really like pivoting. It's almost, I think, just being able to explain your original concepts and something that someone resonates with and grabs onto and understands. And sometimes as founders, you understand the mission, mission, vision, and purpose of the company and why you founded it and why you're doing what you're doing, but translating that into a language that others understand for highly complex and very costly problems, it is a challenge, and I think everyone, for you, Stephen, understands obstructive sleep apnea, but do you understand, why we don't have solutions for it, or why the surgery is so bad that nobody in this room would probably want to go through the surgery to get your palate removed? Those are very kind of challenging problems to kind of say to others and explain the economic impact, or just kind of the personal impact when you're deeply involved in that space. But MDC brings together, and I think our Baltimore ecosystem here brings together a lot of expertise there to refine that pitch and make you successful in the grant work, so that you can very clearly and concisely get to what you need to in a very short amount of space and in a very short amount of time to kind of pitch these ideas and to write these grants and do this multiple times and iterations of it every month and every week.
Yes, thank you. So I want to, before we open it up for Q&A, I'd like to finish off with some lessons learned that we can share with the audience. I think for me, it's especially transitioning from purely academic research, that I'd been trained for many years for, to jumping into the startup world. I think if I could go back, I would take I think I would tell myself that it's supposed to be uncomfortable. It honestly feels like I was starting grad school all over again, where I start very naive, full of hope, only seeing promise and potential, and then after a few years realizing, wait, I don't this is not comfortable. There's a lot I don't know. I'm definitely not an expert. So I think just facing those shortcomings and weaknesses head on from earlier on. Some people will say, oh, financial projections, you'll pick it up as you go. Well, I didn't pick it up naturally through osmosis. I think it's something that I should have faced head on earlier on, realizing that I'm going to be bad at it at the start. And things like pitching. I became very good when I was in research. I became very good at doing academic presentations. And initially, when I started pitching, I thought, oh, maybe I can just adapt my academic presentations into what I think is supposed to be a pitch deck. But I was told, luckily, I had a mentor who maybe completely turn upside down, and just realize that it's really different, and I had to really shift my way of thinking. Stephen, how about you?
Yeah, I think I completely agree. Early on, I think I kind of assumed that, because I knew the technology, I knew where it was supposed to fit, because I was working with a doctor, right? They were kind of helping me define what this technology should be. I felt like I had an understanding of the entire space around it, which was completely untrue. And so I think had I, asked more questions and engaged more people from different backgrounds really early on, I feel like I would have been able to I would have been able to answer some of the questions that I have now, or have had over the years. I would have been able to answer them a little bit faster. And so, being in an environment where those people are around, I had that crutch basically. So when the question popped up and I didn't know it ahead of time, I was able to find somebody to ask relatively quickly. And I think the other thing that I've learned over the years is that it's really easy to find people to tell you that whatever you're doing is right. Let's say for a pitch deck, for instance, I'm on probably the 80th version of my pitch deck for Sanosa, and each version, which was 10 times worse than the next version. At every version, somebody told me that it was really good, that it had all of the information that I needed. It was the right length. It was, it had the right graphics, whatever. And then, you go talk to another, you talk to one person, they said it's great. You talk to two more people, they said it's great. Then you talk to another 3 people, and they all told you that it's the worst, pitch they've ever seen, and you're missing all this stuff. It's way too long. It needs to be this number of slides. And so I think one of the things that I've learned over the years is how varied many of these things need to be, and how tailored everything that you need to do is to whatever the specific audience is. Yes, there are a core number of concepts that need to be presented, but who you are presenting to matters a lot. And so everything really needs to be tailored every single time. And so having the right people that have the right backgrounds to kind of help you do that is really, really valuable. And so I think, it's just like a family, it really takes kind of a village to do all these things, to start a company. And so that's kind of what I've learned, I would say.
Thank you. How about you, Brian?
Yeah, I would say that some of the very important things that I learned along the way was that maybe about 90% of this is thinking, and thinking is free, which is awesome, and strategy is free, and the things that I got largely came from strategy. It was like during COVID, recognizing that there was an emergency use authorization for trying to improve breathing and ventilation quality, and taking advantage of that. And that was a very strategic move to push this, through the FDA and get some, for that, emergency use authorization, a lot of free and advice from the FDA along the way. Similarly, can be said, kind of for multiple steps, is that it was strategic, and again, going back, a lot of this also came from networking. Everything is bringing, kind of knowing people who can facilitate this, not just mentors, but your team and others, and taking advantage. It wasn't really until I brought in, kind of brand names like, Amazon Web Services as a partner, or J-Bill as a manufacturer, Latham & Watkins as my regulatory counsel, et cetera, and making and forging those foundations. And that networking is incredibly important, but it's getting out there and meeting people face-to-face, which is certainly hard during COVID. The messaging is also really important. For example, if anyone in this room, if backup cameras in cars didn't exist and you were trying to pitch backup cameras in cars, I couldn't tell you how many venture capitalists would look you in the face and say like, hey, you can just turn your head around, right? You can just look, I just look at my rear view mirror, right? Like, why do I need a camera? I don't need a $1,000 system to put a backup camera in a kind it's up to you to kind of get that messaging across. How many people and how much accidents and how much impact, and what is the, kind of larger picture here when you actually implement these systems. That's what's strategy and, kind of being refined here. But, just kind of wanted to highlight as, I think, very important strategy, networking, making use of large industry partners, and I think being very persistent. If anybody here who's in the entrepreneurial space will tell you that you hear no more than yes, but it only takes one yes, and that's all that matters. It's just the one person who will fund you, the one person who gives you the grant, the one person who becomes a large partner. It's all that matters. And you can hear 100 no's. It doesn't bring you down or anything, and you have to be kind of just infinitely resilient every single day, just coming in and being like, I need to save lives. I need to make the world a better place. I cannot have people dying every single day when I go to work. Got to change that. And have that mission, vision, drive. It doesn't have to be life-saving. It can be a lot of different things. And it can be out of convenience. It can be out of making impact in the Department of Defense to strengthen our nation. And having these bigger overarching goals is what drives, I think, all of the entrepreneurs and why people probably even came here today. But I think not losing it. It's very, you have to be extremely resilient throughout that.
Wonderful. Thank you so much. We can take some questions from the audience. Yes. Yeah, I can get started. So I think, oh yes, we can repeat, sorry. So yes, the question was, how do we decide to leverage or, give up things like equity in order to gain other things? How did we make that decision? So I think for me, I kind of, so as I mentioned, I was very naive, when I started out. I, trying to develop a medical device. I'm not an engineer. I also have zero business background. And so, yeah, initially, I didn't, I wanted to see how it would go without, giving up equity or money or other things. But I fumbled around for maybe several months, try to apply to grants, I kept hearing about this thing called ICOR, but I was like, what is this customer, why do I need to talk to customers? I already know that this is supposed to be for brain tumor surgery. So I think, I fumbled around a little bit at first, and then I realized, okay, I'm actually not getting anywhere. I mean, when I started, I didn't know what a value proposition was. And then getting feedback and realizing that I didn't really know what I was doing, I think that got me to a point where I said, okay, I'm willing to give up this equity. And I was still, with the way it worked at MDC, I still had majority ownership. So that helped me to feel a little more comfortable about it.
Yeah, I think that's a really good question. It's hard, I think, to give up equity, or to get to a point where you're bringing on a resource and deciding whether it's that particular resource is important enough to give up a piece of your company. I mean, I still have that struggle every single day, every time I talk to a new advisor, and I'm wondering whether I should just pay them cash or whether it makes sense to give them some fraction of a percent or a whole number of percent. So that's a constant question. It's not something that that you just you just get over and you just are comfortable with it. It's really about I think how what step is it or what is it enabling, and if it enables you to, let's say, move faster, and that's really meaningful, like if you need to get into the market quickly, if you just don't have the cash and it's going to take you a really long time to be able to get the cash to afford something like that, then it's an investment yourself, right? Putting that money, that future money, into getting the right advisor right now, or whatever it might be, getting another founder, somebody that can put the same amount of effort that you're putting in. those things can provide so much value early on that they make up for themselves in the long run. So yes, it's always kind of it's always a calculation, and it's always a bit of a gamble when you give up equity. But you should always consider the fact that you have some control over that as well with equity. Whether it's an advisor or even a startup studio, if they're being if they're flexible enough, you can put certain milestones into these agreements so that you're not giving it all up all at once, right? You're distributing it over a period of time. You're distributing it based on the things that you need those people or those resources to do for you. And so you can think of it as more paying for a specific thing with that equity, which you can keep in your mind as a cash value or something like that if it helps, but you're actually paying for a specific thing. You're not necessarily just kind of gambling this equity on some, ambiguous support that you might get. Does that make sense?
Yeah, I should. I also wanted to add. I forgot to mention. So before I officially joined MDC and signed a client agreement that gave up equity, I actually interacted with the MDC team. Probably for almost a year before I actually officially joined them. So I think that's another way I kind of prepared. So I knew who I was working with. As Brian mentioned, it is a long-term relationship. At MDC, we work with companies over the course of years before they graduate to become more independent entities. So that's another way I decided, and I wanted to know as much as I could about what I was getting into before I signed anything. Brian?
Yeah, when I think about kind of any of the business transactions that I've been involved with, it's always about taking someone away from their mission to join yours. And how do you get them to do that? Is it a social mission? Is it straight up cash right now on the table? Is it equity? Or is it something in the future? And everyone's going to have a different perspective, but I got a lot of stuff for free. So Hopkins will patent things for you for free. Why? They get royalties or possibly equity, or there's an arrangement for licensing. That's awesome. Why would J-Bill want to manufacture and put some manufacturing pro bono resources into your company? They would want to do so because they want your manufacturing. If you're someday going to be making 1 million units, they would love to be part of that and have that contract. Same thing for legal services. There are kind of early stage sectors of with divisions within kind of large legal entities, and for example, Latham & Watkins has an entire kind of early stage development that they will do this for you in the hopes of being your general counsel after you're successful. Similarly, there's kind of grants, which doesn't get much better than that. You don't have to give away anything and you just get money. Awesome. And then you have things like startup studios and partners who are going to have an ask, but it's up to you to negotiate. If someone asks for 40% of your company, it better be giving you something really, really good. They're gonna, that's going to be a full-time, lot of money. You have to have something really good. Now, certainly, again, it's a two-way street for all of this. You're taking someone's time and money or resources and leaving their mission to join yours, and you have to have it make all sense when you kind of put it all together. But there's a lot of resources out there that don't have direct asks, but it's up to you and where you are in the company. If you're, let's say you're making $1 million ARR and you have a $15 million valuation, are you going to give up 40% of the company? No, especially if it's not for the right reasons. But early stage companies, it really depends on what you're doing. How hard is the problem that you're solving? What resources do you bring to the table? Do you have a patent, or is it just an idea? And what is the ask? And that's kind of the other thing. You have to be like the ultimate deal maker here. You have to be able to sell that vision, bring things to the table, drive people away from their goals and missions with incentives. And there's a lot of ways to incentivize people. And then there's clawbacks on top of it. So you can give 40% to me, but if I don't meet any of your goals, you get the 40% back. And you have to be, kind of, it's a two-way street there that, if a venture capital company is going to, give me $1 million for 20% of the company, but they don't give me the $1 million, I'm not going to give them the 20%. So there's a lot. It's a very complex, business transaction with kind of multiple different ways to structure it, but you have a lot of resources to do so, and a lot of things that can be given up, either direct contracting, like I said, equity, royalties, cash payments up front, deferred payments, loans, positions, titles, getting people to join your social mission, and the list goes on. But it's kind of up to you to draw people away from their mission with what makes sense for the company as well.
Any other questions? Great. Well, thank you so much.
Thank you.
Thanks, everyone.